Hello, hello. We are here, episode number 3 de Todo a Todo with Valeria Juarez. I am super excited for today's guest. We have a board certified in newborn pediatric medicine, pediatrician and neonatologist, district medical director of San Benito CISD community, more than 26 years of experience. He's married and has 4 children, ages 11 through 22. And he plays cricket professionally for the Austin Jaguars. So we are here with Dr. Shah, Cute Pediatrics. How are you, Dr. Shah?
I'm doing good. Thank you so much for your time.
I love to be here. I feel at home. It's a great environment here in Cute Pediatrics. It's the new clinic for my kids, so I'm really excited to be here. And I'm excited that you brought this clinic into Brownsville. I feel that we needed a new clinic with such an amazing doctor specialist. I feel blessed that we have you here in Brownsville. So
Yeah,
thank you
so
for
much.
being here. So I want to ask you a little bit about your background. So Dr. Shah, tell us a little bit about your background. I know that you graduated in Pakistan. So can you tell us a little bit from where you're from? How was your family like? And how you got into the medical field?
Yeah, thank you so much. It's a long journey, right? I was born and raised in a very, very small city, or you can say small village actually. Very similar environment like Brownsville, Harlingen, or overall state of Texas. The state where I'm from is the name is Punjab, which is have all the 4 seasons, and I was born and raised there. And during just like when I was just like studying, I was the youngest of all.
How many are you in your family?
So 3 brothers and 2 sisters.
Okay.
I was the youngest of all. I used to spend more time with my dad,
Okay.
and he was not feeling well. I used to go with him to go to the hospital, to go to the physician, and that's basically was my inspiration. Because my dad was super impressed with the physician because he used to get better with the medicine.
Okay.
Right. So then I was just like following him, just like holding his hand because he was having like shortness of breath.
Okay.
So I used to go with him and see how everything is happening, right? So the main person which I was impressed with was the provider, which I was thinking was not the which I was thinking is a physician, but he was not the physician.
Okay.
But he did such a great job that he was one of my inspiration.
Wow.
Right. And later on, and look, I became the physicians.
Wow. Did your dad had a medical condition? Like he was in the medical, he was always going to the clinic and getting checked?
Yeah, he used to work very hard for us, and by working that kind of hard profession, he developed just like lung disease, and he will be in need for the steroids or all the other medication all the time. I was very young at that time, so I used to.
What was the age, more or less?
That's just like 8th or 9th grade.
Okay.
So I always go with him because he will walk for like 10, just like 10 feet, and he has to sit down. And so one day he asked me, what you want to be? I said I wanted to be an engineer. And he said, engineer, not doctor. I said, you want me to be a doctor? He said, doctors are good people, So and you are the youngest of all, right? So you can be a doctor. I said, yes, okay, no problem. The reason I wanted to be an engineer because I can get 100 out of 100.
Okay.
Right, in math. And for
You were very good at math, so
right.
You were like, okay, engineer.
Yes, it's
okay.
easy, right? And for biology, you have to. And he said, no, you will do very well, and you will be famous.
Wow.
I said, I will be famous. I'm telling you this story when I was walking with my dad, and we were going to see a physician or the provider, right? So when we are sitting down and talking,
that's when you talked.
And he said, you will be a famous. I said, how famous?
He saw it in you.
And he said, you will be very famous. Your name will be in the universe. I said, okay, fine. So, and then I said, you will be a doctor. I said, okay, Dad, I will be a doctor. And that was the conversation. So the reason I'm just like bringing this one is this is a connection. And just like believe what my dad has in me. And And since he said that you will be a doctor, believe me or not, I thought I will be a doctor.
Yeah.
Right.
If your dad is telling you,
Exactly. And I said, okay, so I will be a doctor. So then I will just like treat you, right? When I will grow up. And he started crying. He said, I will not be alive at that time. And exactly the same thing happened, right? So point of sharing is, so just listen to your dad, listen to your family, right? So I am from that kind of family, right? And look, whatever he told me, everything happened like that. So when I graduated from Pakistan, so I made a clinic with his name, and I practiced for 6 years. So with his name. After serving, I came to this country in 2005.
Yeah, so you graduated in 1999, and then you practiced for 5 to 6 years, and then you came and did the residency and all of that, right? So I think it's important that, Dr. Shah, because I feel like any young person watching right now that wants to do anything, it's not going to be easy, and it's not going to be from one day to another. It's going to take time, right? It's going to take, like for you, I like to call it the 5-year plan, where you practice, where you dominate the sector, what you want to become. And I love that you shared the story about your dad, because my next question was, were you influenced by anybody to become a medical and you already answered that, right? It was your dad. So the power of a father, right? And seeing you in your eyes, and I bet you when he told you that, you believed it. And look at you, Dr. Shah. I know he'd be so proud of you. I want to cry already. Okay, but so 6 years later, you move into USA. Tell us a little bit of where you went. I know you were in Yale doing research. Tell us a little bit of how you got to Yale and what you did there.
Right. So this is very natural when whenever the medical graduate coming from any other country, so they, whatever they have done in their country, they have to prove it, right? So they have to go through all the certification, and that's a process. Like United States medical license examination, you have to pass all 2-3 exams to get into the residency. I came in 2005 and looking for the mentorship, right? Because nobody knows me. I really want to show what I can do, what I'm capable of, right? So then I start just like communicating with different universities and looking for the opportunities. I already have decided that I will go into pediatrics, right? So then I approached, and luckily I got the opportunity to work with my mentor at that time, Dr. Dinesh Peshankar.
Okay.
He is just like well-known, world-renowned gastroenterologist. So I discussed my dream, my plan with him, and he provided me the opportunity. I started working with him as a research assistant.
Okay.
And at that time, there was a project was going on obesity and obesity in children, right? Because that's a growing pathology even at this time. So we really want to know the relationship between the obesity and gastroesophageal reflux disease, right, or burning sensation, right? So then we did a retrospective study and also just like prospective study, and we found a point, right, that there is a strong relationship. So at that time, Dr. Peshankar helped me, just like teaching me about all the research techniques, how to collect the data, how to do the analysis, and how to publish. So I'm super thankful to him, that great mentor who helped me at that time. So that not only helped me to enter into the medical system, but also learned me the basic techniques, but foreign medical graduate needed.
Yes, and I love that you mentioned that he was your mentor. I was actually going to ask you about that. I think it's so important for anyone going into any field where you're new, especially you, Dr. Shah. You came from another country, like not knowing anybody, knowing that you had practice, but now you have to prove it, right? In a new country, you know, with new people, and how important it is to have a mentor, to look for a mentor. You said you discussed your vision, right? Your plan for yourself, your dreams, your goals. How important it is right now for the young generation, right? Whatever it is they want to do, whether it's doctor, lawyer, whatever they want to do, an entrepreneur, having the right mentor that you can share not only your dreams and your goals, but that you can learn from him. So that is amazing that you found him right in Yale, and And I love that you have a passion for children, and also that your research was about, like you mentioned, gastric reflux and how obesity has a main role in that. And for me, that is a very special subject because I've been helping people lose weight for 10 years with what I do. For me, it's a touchy subject. For me, obesity is important because, well, we live in a very obese state and city in Brownsville, one of the most obese cities. And so I think we have a lot of work to do, right? And a lot of education. And I would love to get together more with you so we can help, right? More people in that. So you also worked in Columbia University, and I heard that you were the best resident of the year twice. So tell us a little bit about your experience at Columbia.
Yes. So after completing that project, I got the opportunity to get a position as a postdoc research fellow at Columbia University in New York. And again, I mean, I was lucky. I found another mentor, Nicholas Morrissey. He's a surgeon, world-renowned surgeon, and I work with him. And we basically work on the stent placement in a pig model, and see why the stent closes, or which stent should not close, which stent should have the medicine.
Okay.
So I worked with him and completed that project. And I was at this platform, I would like to say thank you if he's listening. So thank you so much for your help and kindness. So he was another addition of as a mentorship in my life, right? And then I got residency in Bronx-Lebanon in 2008.
Okay.
So I was like super excited, and with just like vast experience in my country, 6 years, then 2.5 years of experience of research, I was super excited to do the best possible learning, and maybe that everything just like connected very well. And I was the best resident of the year twice.
Wow.
And that was the first time happened in the history at that time that the guy from Pakistan became best resident two times.
When did you get married, Dr. Shah? I'm like, what was the year when you got married?
Yeah, I was married in 2000.
Okay, because sometimes, okay, so then it's after your practice, after your residency. So you did your residency and then you got married after.
I finished my medical school in 1999, so I was married in 2000.
Oh, okay, in 2000.
Right.
Okay, so, and then you had your 4 children during your study years, your practice. I have 2 kids right now, Dr. Shah. My husband is an RN, and I kind of took a step back from what I was doing because of my 2 children. So, oh my God, how did you do it with 4 kids and your wife and everything you were doing? Tell us a little bit about your family.
Yeah, so I was married in 2000, and the good thing was my wife made a decision early on that she will spend time with kids, and with the passage of time we have kids. So at least that was just like big peace of mind for me that there's someone designated, the best possible person for that job was at home, and I think that's why it happened. So I would continue to work what is happening with my profession and how I can just like focus on my stuff, right? And she can take care of the kids.
Yes, and so you started practicing, you finished in Columbia, and then how did you get to Harlingen and everything you've done here in the Valley?
Right. So just like a little bit more points. So after Columbia, so I went to Bronx-Lebanon. I did my residency, right, in pediatrics, which was my dream to really understand the pediatric medicine. Because when I had a clinic in my country, I was a family physician, right? So I can understand everything. But whenever the things were coming closer to the pediatrics, I was struggling. So even I decided I will go into field of pediatrics.
Okay.
And that was the reason I did my fellowship in my country and then over here too.
Okay.
Right? I really want to know. I want to know how I can understand pediatric medicine better.
Okay.
So with the help of Columbia, credentials, and hard work, so I got residence in Bronx-Lebanon, which was 3 years. So completing residency in Bronx-Lebanon, New York, that's an interesting story. When I remember when I went into like pediatric medicine, they put me into the, my first rotation was in the neonatal intensive care. And look at the baby, and baby was too small, maybe just like the size of a cell phone. And it's a 23-week baby, and I can see it's a breathing and his heart rate and all. I was like, I never saw such a small baby in my life. So, and then I went to my mentor. I said, I wanted to be a neonatologist. He said, you're trying to impress me? I said, no, I mean this is just like next level skill, right? How you can intubate, put the breathing tube in that small baby, putting the lines. And she said, this is the field of neonatology. So I was so much impressed that I wanted to do the best possible thing, the most difficult thing in my life. I said, okay, I will be interested in neonatology, neonatal medicine, newborn medicine, right? So then at the end of the pediatric residency, I applied for the fellowship. So I was lucky, I was selected as a neonatal fellow at University of Rochester, New York.
Okay.
So and then I studied another 3 years in neonatal medicine, right? And then I just like passed that everything with just like flying colors. After finishing fellowship and pediatric medicine, then I started working as a assistant professor at University of Texas, San Antonio. So then I came to UT San Antonio.
So you were a big chunk of your life in San Antonio as a professor.
Right.
And tell us a little bit about the University of San Antonio. So you were there for 6 years?
Yes, 6 years. So the funny thing is, when I was finishing my fellowship, everything about New York was so beautiful except weather. Weather was too much extreme for me.
Yeah.
So after finishing my fellowship, my program director was asking, where are you going? I said, there are 3 states. Okay, either I'm going to Texas, Florida, or California. So she said, all warm state? I said, yes, because New York is so beautiful, but somehow I really want to go so that I can do some outdoor activities.
Yeah.
So then I was lucky enough that I got a position as assistant professor at UT San Antonio.
Okay.
And that was just like mind-changing. It's just like one of the best university and experience in that town. I worked over there for 6 years.
And what did you teach?
Yeah, so whenever you work in a university setting, usually there are like 3 components to the medicine. Number 1 is you will be seeing patients, right? All the neonatal intensive care, sick babies. It was just like a tertiary care center where all the complex patients will come. The second is you will be heavily involved in the research projects, right? And number 3 is teaching. So we used to train pediatric residents. They're coming for training, nurse practitioners, fellows. So I was heavily involved in education, and I learned a lot from my mentors and from my colleagues.
Wow, that's amazing.
And after finishing there, I joined Driscoll Children's because over the period of time, I discovered I like more clinical work as compared to the research. So then I shifted the gear towards more clinical work. So I joined Driscoll Children's Hospital.
Okay.
2020, and since then I'm with them. And I got promotion. I just like working here at Harlingen, Valley Baptist Harlingen. They promoted me as a medical director. And when I came here, I said, oh my God, this looks like my village. This looks like my city. I felt it. I just like...
Brownsville is very special, and Harlingen, right?
Exactly. So then when I came to Brownsville, I said, oh my God, this is... It's just like it looks like I'm walking and just like chatting with people, just like in my country. And the people are looks like so warm and welcoming, and food is so delicious. So I really just like started liking it.
Oh yeah, I saw you eating those chicharrones.
Yes, and I'm learning.
That's
so
awesome.
Now I'm working here as a medical director at Harlingen Valley Baptist, and taking care of neonatal babies. And then on free time, so we have 2 clinics. One is in Harlingen, one is Brownsville. I have providers. I just like supervise them.
And how did you get into cricket? I mean, you told me since your childhood, but so you play professionally with the Austin Jaguars. And how does that look like?
Yeah, I mean, I'm a family where everybody plays cricket. Right, I've been playing cricket when I was just like a baby. My brother, he's playing right now. He's representing USA.
Wow.
So he's better than me. But whenever I have time, I play. I have represented USA Jaguars, and even the last week I was playing in Houston. Yeah, so I'm trying my
Wow,
best.
that's awesome,
Yeah.
Dr. Shah. I know when I saw you, I was like, oh, he's an athlete, he's a specialist. I mean,
Right.
you're living your best life, Dr.
Yeah.
Shah. So
Yeah.
congratulations and thank you for everything that you're doing in Brownsville. I know you just got here, but I'm just so happy that you have this clinic, and I know that we needed you here. So thank you for your time and for sharing your beautiful story. I feel touched by your story. I feel inspired by your story. And I know that everyone seeing this video is going to be so inspired, especially anyone going into the medical field or learning or wanting to be successful in life and have purpose. I think that you are a great example of what success really is. It's not just about the money and the luxury. It's about purpose and finding what you love and doing what you do with passion and with care. And so just thank you so much for this time. And I know that we're gonna take a tour of this clinic so that everyone in Brownsville knows what Cute Pediatrics is like, and you guys get to see the tour. So join us for the tour on the next video. Bye.
Thank you.
Okay, Dr. Shah, so we want to know a little bit more about the two clinics that you have. I know you have one here in Brownsville and in Harlingen.
That's a great question. So both clinics open every day, right? Timing is a little bit different, but open every day, and weekends are open.
Okay.
For example, if I'm talking about the Brownsville, so the timing is 9 to 3 on Saturday, and 2 to 8 p.m. on Sunday.
Okay.
So that's just like
So Sunday to Sunday, they're open here in Brownsville.
Right, exactly. And on weekdays, it will be open like 9 a.m. to 6 p.m.
Okay.
So it's a little bit longer hours, and we have 24-hour nursing line.
Okay.
If your child needs help, you can call us at the number, just like a message just come directly to my phone. So I can call them from 210 number. You guys should not be surprised.
Okay.
Dr. Shah is calling you.
Okay.
And then we have all the main facilities. For example, if the blood work or urine analysis or basic testing or imaging, so we have available in Harlingen Clinic as well as in the Brownsville.
Perfect. I love it so much. Doctor, also tell us about, I know that you're teaching other students, so can you tell us a little bit about that?
Yeah, so teaching comes because during my whole journey, I would like to pay back, because in each and every step, I just got a lot of mentors. I'm super impressed. I think it's my time to give them back, right?
Yes.
So I'm feeling so much honored that I'm working as a community assistant professor from UT RGV, and we have affiliation with them, right? And they are sending the students. So even as we are speaking, so we have just like medical students being rotated here, just like a nurse practitioner student, physician assistant. Even if somebody needs any hours or anything, we are here to help you.
I love that.
Because we are here to support our future generation.
Yes.
And maybe a day will come when they will be treating me, right? So it's my time is to give them back. So we are open, and you guys can contact us at info@cutepediatrics.com. So just give us a message or send your resume, and we can look at it and see what is the best time for you guys to learn.
Perfect. And I'll leave their information here on the bottom, so make sure you reach out. Thank you so much, Dr. Shah. And for the last comment that you want to make for everyone watching and they heard your story, I'm sure they were inspired like I was. Do you want to give us some last comments for everyone watching?
Yeah, just like a simple concept. Please do not forget those people who supported you, right? And just like start from your brother, from your sister, right? Your dad, your mentors. I remember when my father died, my brother took over, and he said, just like study. He should have just like put us to work. He said, no, I'm here, just work. So, and still I have connection with him. I'm talking with him. He's just like my father. Just like be connected, work on your family system. You will get everything in life except family.
Yes. Oh, doctor, thank you so much. And we will see you on the next video for a tour of the clinic. Thank you, Dr. Shah.
Thank you.
Hi, Dr. Shah. Can you give us a little tour for our YouTube viewers?
Yes, sure. Thank you so much for coming here.
Yes.
Okay, so you come here and you will be seeing our receptionist, Miss
Hi.
Michelle. And we have the registration form, you'll just like fill it up. And then we have only one page registration and just like you will be in.
You taking new patients every day?
Every day we are accepting all the new patients. We are accepting most of the insurances, private pay. So our main goal is to provide care,
Perfect.
irrespective of all that. Just please come in.
Okay.
So we have a playing area for the kids.
Yay.
To just like distract them. If they're in pain, they should not be feeling like that. So we have like maybe 2,000 games. They can keep themselves busy.
Oh yeah, they
We
stay
have-
busy here.
We have books to study. We have the hallway and we just like remove all the chairs and we have sofas. So if you guys come here, please be comfortable. At
Very
least-
comfortable, doctor. I love
Right?
to sit in those couches.
Right. And you will see we are playing Bluey cartoon most of the time, which is most of the people's favorite.
Love it.
When you come here, especially being as a neonatologist, we are super concerned that your baby is not affected by contamination or any other infection going on in the community at this time. So when you come here, so your newborn will just go directly into healthy newborn area.
Love
Okay.
it. So there's a special area just for the newborn babies.
Yeah, let me show you.
Yes.
When you will come here, so you, mom and dad can sit over there, provider sitting over here, baby is over here, in just like a separate room, and we can just like do all the measurements.
Babies only.
Yes,
I
only
love this
babies.
room. I
Only-
love this room. I might go for baby number 3 now.
Yes. And if you come here, so you will see all of my hardworking team. Miss Sylvia,
Yay.
she's our office manager.
Sylvia.
We have just like Greg, our practice manager. Hello.
Hi, Greg.
And hello.
Hi.
Itzel, she's working on the referrals. She's Eileen, she's working on all the follow-up appointments and making sure we're on track. And Michelle she's just like our face and she's just like scheduling all the appointments.
I love it. Love it. Great team. Beautiful
Acute
team.
Pediatrics triage, we can take all the vitals, and we are using electronic health records, so we can just like put information right away into the system, and our system is connected with all the pharmacies and all the current referral system.
Love it.
So this is our lab, and you can see we can do most of the viral studies, blood work, and all those. And we have a patient is ready to be drawn. So blood rooms. How are you feeling? So one of the room is this one. So we have just like SpongeBob. So and we just like put the television in the room to distract the pain of the patients.
I love that every room is like a different character vibe. So
Exactly.
over here is Toy Story.
Yeah.
And the kids, I feel like the kids are excited to see what room they're in,
Right.
to see what character they're going to get.
Right, and the windows are there so they can just like see in and outside, which is just like good feeling.
Yes.
And we have Cute Cafe, which is for my staff. So whenever they need rest, hydration, all those things, so they can just like, they'll bring their own food.
The coffee room.
Yeah.
Very important room, doctor, so
Right,
that they have energy
exactly.
to work.
Yes, that's right. For use.
Nice.
And next room is our cute petrol. And I love it. Look at their energy level. I have a Marvel Universe.
Wow.
Hello. And the patient is already here, right? She's so cute. And we have procedure room, so we can do basic procedures like if somebody needs nebulization or hearing screen or ear piercing or the suturing, so we can do it over here.
Okay.
For the health of my own employees, so we have just like Dream Team Gym. So because sometimes we are super busy with patient, we don't have time, so just do exercise over here and then go home.
Wow, this is amazing.
Thank you. And whenever we have like events or some graduation or we have some news to share with the media, so we have all the decoration so that we can convey our message to our community. Over here we have the providers. Hello.
Hello. Hi.
And for the providers we have the name Caring Buddies,
Aw.
right? So we just want to have just like everything just like kind of unique. And this was the hallway. When the patient is coming that side, they're coming over here, and
I love all the decorations. It's
Right,
so Cute. That's why it's called Cute
Cute,
Pediatrics.
right, that is right. On the same note, as we are taking care of the families, so I have a special room for the family and friends.
Oh, wow.
If my workers, they need help, they should not be
Wow.
worried about the babysitting. And you can say there's like comfortable sofas and the television and the restroom.
Wow.
They can stay here too.
So thoughtful for the family and
Yes.
friends that sometimes,
Yep.
you know, need to be here a little longer.
Yeah, it's not happening very often, but whenever, you know.
Whenever you're prepared.
Yes.
Yes.
And we have another room. The name is
The
Loteria.
Loteria.
We
This
are
is my
very much-
favorite room,
Really?
doctor.
We're
Yes.
very impressed. So we are very cultural people, right? So
Yes.
let me see. And you can see all the cultural things have been hanging and waiting to be admired.
Feels like Charo days every
Right?
day here.
Yes, exactly. And then we have the vaccination room and the medication room. And even we have like resuscitation stuff. If somebody needs oxygen or resuscitation, we have the ambu bag. So we have that's capability, we have the oxygen.
And that's
And
about
then,
it.
And then we have the gifts for the kids. When they will be coming, they will be getting candies.
Yay.
You
the
want
best
some?
part. I'll
Right.
take 2 for my kids.
Great.
The same color because then they fight.
Right. And then we have just like gifts for the kiddos. So they will put a coin over here, right? And they can just like turn it around.
Oh, wow.
And they will be getting just like something in surprise.
Oh, that's cute. Very thoughtful, Dr.
Yeah,
Shah.
thank you so much. We are
Thank
trying
you
our
so much
best.
for your time and for letting us come in your clinic.
Yes, of course. Thank you so much.